Okay, so now we are going to look at the structures that are passing from jugular foramen. So there are three important structures that we must memorize. Those structures are passing from jugular foramen. So the one of the most important structures is vagus nerve. So as we understand that the function of vagus nerve is respiration and controlling our main functions in thorax. So when vagus nerve is compressed from passage of jugular nerve, what will happen? We will be understanding that in upcoming slides. Vagus nerve compression passing through jugular nerve. Another structure are glossopharyngeal nerve and accessory nerves. These are passing through jugular foramen. Also, there is uh, occipital artery and sigmoid sinus are passing through jugular foramen. So we will be looking at the clinical importance of structures passing through jugular foramen. Accessory nerve is also passing through this. As you can see in the image, there is accessory nerve passage, vagus nerve, and uh, jugular foramen. Okay, so now this one is the granulomatosis with polyangiitis. It is also known as Wegener granulomatosis. In Wegener granulomatosis, there is upper respiratory tract infection like sinusitis, saddle nose, and there is also presence of lower respiratory tract infection in which hemoptysis will be there, restrictive lung disease will be there in lower respiratory tract infection, and then there is also involvement of the kidney in rapid progressive granulomatous nephritis. So hematuria, uremia, and epimia will be also there. How can we diagnose this condition? For diagnosis, we perform ESR, which will be increased, and complement will be normal. C and K anti-stress will be positive, and there is necrotizing granuloma and biopsy will be there. So in this way we can see nodules in the lungs and upper respiratory tract, and cavitation on X-ray and CT scan can be found. So in this way we can diagnose the rapid progressive glomerulonephritis and Wegener granulomatosis. It involves in nose, lungs, kidneys, and treatment is corticosteroids since it is autoimmune mediated. So corticosteroids is the treatment, very important. Cyclophosphamide is also used in this condition like rituximab, and remission therapy is azathioprine is given in Wegener granulomatosis. So in this way we treat rapid progressive granulomatosis. Okay, so now another important point is galactoria occurs when there are pituitary secreting adenoma or masses are there. Now in this image we have to look at the circle. Hypothalamus has attachment of pituitary gland. When there are pituitary secreting adenoma, then excessive prolactin is produced because of macroadenoma of pituitary gland. Excessive prolactin acts on the breast ducts and nipple discharge will be there. This is milky discharge. If there is milky discharge, no any other complication, there is visual disturbance and other neurological disturbance are there, then we can estimate the pituitary adenoma and we perform the CT scan to confirm this condition. Now other causes of galactoria is physiological causes as well. Nipple and breast manipulation during pregnancy, and then there are certain pathological causes like hypothalamic infundibular lesions, tumors, craniopharyngiomas, and other Rathke cleft cyst and prolactinoma. Acromegaly is also pathological causes of the galactoria. Lesions and chest wall can also result in galactoria, burns, herpes zoster, spinal cord injury, and trauma. Certain diseases like hypothyroidism and medication induced hyperprolactinemia can also cause galactoria. So as you can see in this picture, if there is any involvement of the cranial cavity, pituitary gland, then galactoria can be developed. Okay, so in this image we can see hypothalamus has thyroid releasing hormone, and then it stimulates the thyroid gland. When T3 T4 are produced, they go to the pituitary gland and suppress thyroid releasing hormone, and then even hypothalamus has negative inhibition of dopamine. So dopamine is also agonist performing the function of the agonist and then antagonist with the help of negative feedback loop mechanism. Okay, so another condition is infectious mononucleosis. This is the condition, infectious mononucleosis. There is lymph node involvement, and patient has visual problems, swelling in the tonsils, white patchy covering membrane on the tonsils will be there, lymph node involvement, lymph adenopathy, spleen enlargement, gastric problems, chill fever. Then we perform certain lab investigations to diagnose infectious mononucleosis, and it can be associated with the HIV patient. And HIV patient has also multi-system involvements that leads to a lot of complications. Okay, so now this condition is non-thrombotic endocarditis, which is also known as merantic endocarditis. Now, merantic endocarditis is a condition in which there is mass of fibrin, platelet, and other blood components and deflate of the cardiac valve, and it is associated with the endothelial abnormality, hypercoagulability, and malignancy association is also there in this condition. What happens? Now small nodules on the lines and valve closed, which leads to the aortic valve, most common site in the microfibrin, platelet aggregation, and asymptomatic embolization is also there in the patients.